Hi, we're here with Mr. Trent. He will tell us a little about his experience having Athens Protocol procedure. Hello, Mr. Trent.
Hello.
I want you to tell us a few things about keratoconus.
Okay.
When did it started?
Okay. Well, I first had my eyes checked by a ophthalmologist in the Philippines about 5 years ago. Because I wanted to undergo the LASIK procedure.
All right.
Because I'm still active in sports, most especially, and that's when I first found out about the kind of my condition, and he said to come back to check in again with him in 2 years, and so I went back about 3 years ago now.
Okay.
And that's when he informed me that I'm not a good candidate for LASIK. So hence,
because of the KCN, I mean the keratoconus.
yes, because of the condition I have with my irregularly shaped eyeballs.
Okay, so now you're 38 years old.
Yes.
So when you find out that you have keratoconus, you must be 32?
Yes.
Something like
32, 33, yes.
that. Okay. And how come you came to Greece to have this operation done? I mean, because I know that you live in Manila, Philippines.
Dr. Ong, I believe, knew Dr. Canelo-Lupitz.
Yes. Dr. K.
Dr. K. I think through their Harvard Association or just through an association of doctors that studied in the U.S.
Okay.
So he referred me to Dr. K, even though there is available cross-linking procedures around Asia, and there's now in the Philippines, but he referred me to him because he was the most experienced and the best in the field at doing this procedure. So I further had my results from American Eye Center in the Philippines reviewed by Dr. Dury, who's a prominent eye doctor in the U.S.
Okay.
And he also knows Dr. K, and he said, you're in very good hands. So I wanted to go to the best. There's no price, doesn't matter how much price I put on my eyes, right? So that's why I'm here, because I wanted the best.
Great. I want you to tell us a few things about your whole experience. I mean, the first time you came to our center, then the procedure, the day of the procedure.
Okay.
How did you feel? I mean, did you feel safe? If the operation had any pain?
Right.
Stuff like that.
The staff, the employees, everybody here was extremely friendly. From the moment I walked in, and there was very little waiting time, even though you have a lot of patients here. Everything moved quite efficiently, it seemed.
Yeah.
I thought that Flavel, who took care of me most of the time, she was kept me very well informed throughout the test and leading up to the procedure, which I came back the following day for. The procedure itself, Dr. K briefed me on it, so my anxiety level was kept at bay and kept at a minimum. So he kind of the procedure, I think, went as planned. I'm not sure if it was part of the kind of keeping my anxiety level down, but they said I experienced a little discomfort, that night. But it was probably some of the, and I have a pretty high pain tolerance, but it was probably some of the worst pain that I experienced. Simply because it's like I think it's more because you have like an itch you can't scratch, because it's your eyes. Like when you have a toothache, it's a weird pain. It's not like breaking a leg or an arm or getting burned or something. You can take that. So the eyes were pretty bad just for one night.
Yeah.
The next day was.
We always say that. I mean, the first day it's gonna be hard.
Yeah, it was. I could not stop moving around because I couldn't get comfortable. So very little sleep. But the second day was fine onwards. So I think overall it's too early to tell.
Yeah.
Because
No,
it's been
it's
11
just-
days and my eyes are still my vision is still very blurry.
I know. That's the.
So
Gradually, it's gonna leave the fog.
yes.
So
Yeah.
we'll see.
I hope so.
So that's all. I want you to talk about your whole experience, and
Yes.
I will also like to ask you if you're gonna recommend laser vision to other patients.
It's too early to tell.
Yeah, because
From my experience, absolutely,
Yeah.
without a doubt, you guys.
just
you
for the
guys-
experience, because
Yeah,
you know,
from the experience, absolutely.
Yeah.
I think it's.
the results we're gonna have
yeah,
to wait a little bit more.
yeah. It seems like you have all the equipment, the best equipment, and the staff. You guys are all fantastic, you know, and kept me up, like I said, informed and very accommodating. Yeah, overall, I definitely would recommend you.
It was a pleasure meeting you. Too.
Thank you very much.
Me too.
Tina.
Bye bye.
Bye bye.